Let's talk about the female anatomy and what it looks like from the inside. If you don't know me, I'm Dr. Nabila Noor, urogynecologist and a pelvic reconstructive surgeon, and this is a schematic that I use when I'm seeing my patients in the office and reviewing with them what pelvic organ prolapse look like or other pelvic health conditions. I was actually reviewing this picture for a project, and I figured I'll take a minute to just review it for all you guys who follow me on social media, because I think every woman needs to know about their body. So you ready? Let's get started. So just for orientation, by the way, this picture is taken from the AUGS website. So AUGS is the American Urogynecologic Society, which is my society, which has a lot of helpful information. So just kind of for orientation's sakes, this is a side view of the female anatomy. So if you can imagine, the top is where the head is, this is the front of the body, this is the back, and of course the legs are right here. So imagine somebody just sliced open the woman from head to down. So it's a side view. So the first thing you see right here is the pubic bone. So right behind the pubic bone, you have the bladder. So the bladder is our organ that holds urine, and then we urinate through the urethra. Right behind the bladder, we have the vagina. So I always say that the vagina, think of it as a cylinder. You have the anterior wall, which is basically the top wall against the bladder. You have the back wall, which is the posterior wall, which is against the rectum. So the rectum is the organ that holds stool. And then when we have a bowel movement, basically stool comes out through the anal opening, which is shown right here. And then on top of the vagina is where you have the uterus and cervix. Now in a normal anatomy, everything is where it's supposed to be, as you can see in this picture, because there are support structures that hold these organs in place. Now, what do I mean by that? So you have the pelvic floor muscles, which is basically right here, which acts like a base that's holding all the organs in place. There are lots of ligaments and connective tissues that's holding the uterus, the bladder, the rectum in place as well. So when these support structures are not working well, then all these organs can stay in its position and essentially are trying to push through the vaginal wall. And that's essentially what pelvic organ prolapse is. In my next video, I'll show you what prolapse looks like, so keep an eye out.